request is one of the indications for cesarean section. Another indication for cesarean section is cephalopelvic disproportion. Your pelvic bone is not fine for you. You don't have adequate pelvis to deliver a baby through the vagina, and you still want to push. You will leave that child. Either the child will become a special needs child, or your pelvis will scatter, your pekus everywhere will scatter. In fact, you yourself will go from there. So when you have a cephalopelvic disproportion, you are not supposed to beat your baby from the vagina. You just go for cesarean section. So how will you know you have inadequate pelvis? By going for antenatal, keeping to appointment, your medical appointment with your doctor. Another indication for cesarean section is what we call big babies, macrosomic babies. You want that baby to clock 8 kg, like that woman said in that post I made, that the weight of her baby is 8.8 kg. You cannot push that kind of baby. God is not mocked. I am going to explain the fetal score with my dummy or my baby, I don't know, so that you will see how it is done, or I can use the board to describe it. All right. So when you have macrosomic babies, they can't pass through the birth canal, and when you try that, you cause yourself some problems. You will just destroy your pelvic cavity, pelvic cavity. Your womb is at stake. You may rupture your womb, and your fetus or your baby's life may be at stake. So macrosomic babies are no. Remember the adequate weight. The normal weight for a healthy baby is 2.5 to 3.5 kg. So when you are eating during pregnancy, please be cautious of what enters into your mouth. The actual weight you should gain from 0 to 40 weeks as a pregnant woman, additional weight of 12 kg. So mind what you are eating and ensure you go for your antenatal. Another indication for cesarean section is what we call hydrocephalic. Hydrocephaly. Yes, these babies with a larger size of the head, with the sunset eye. Their head is too big. That is what we call hydrocephaly. You cannot push that head. So once your scan reveals you are carrying a hydrocephalic baby, prepare your mind to go for cesarean section. Then another indication for cesarean section is malpositioning. Instead of your fetus to be positioning in a way that will be easy for vaginal delivery. I don't want to go into deep to mention those terminologies. Your fetus is either breech, or presenting with foot, or with hand. All right, or in this transverse position, breech with buttocks. You don't do such delivery from the vagina. You will just go for cesarean section. I know that most of you will go to try delivering from the vagina. You will go and tell Mankechi to please manipulate, do this magic, so that you will turn the position of my baby. They will be on the process of turning it, and you yourself will pay with your life. So you don't have to do that. Another indication for cesarean section is what we call placenta abruptio. This one is accident. No one plans it. That you are pregnant at 38, 39 weeks. Even some will come while you are in labor. Placenta abruptio. The placenta will just detach from inside. Remember, it's the placenta that supplies the fetus oxygen and nutrients. Now, the placenta detached from its place of attachment or embedment, and now blood will fill up the uterus. What will happen? That fetus will start suffocating. So when you have placenta abruptio, it is just emergency case for cesarean section. Now we have what we call placenta previa. Instead of your fetal head to present, instead of your fetal head to come out first, it is now the placenta that is coming out first. You don't even try to push. You will not even try to push. So you will just go straight for emergency cesarean section. Then another one is maternal exhaustion. Oh, you are going to that quack to deliver because she's collecting 15K from you. All right. And she started from when your cervix is 7 cm dilated and now asks you to start pushing and you are pushing. Before your cervix will get to 10 cm dilatation, you get so tired. All right. When you are tired, you cannot push again. What awaits you? Cesarean section. And we have fetal distress. Yes, she have subjected you, tie a wrapper on your waist so that the baby will not go up again. She's, doing those things they used to do, early induction of labor, so you can deliver and she will have the money. And now the fetal heart rate starts dropping. Oh, we cannot wait to allow to see this child, going in our presence. So the next thing we are going to do is cesarean section to save your life and the life of that your baby. These are the indications for cesarean section. I'm going to talk about more indications for cesarean section, but for now, please always adhere to your doctor's instruction. Always follow doctor's advice. Don't run away. Don't say I cannot deliver from through cesarean section.